Welcome back to the Nurse Scrub Club. I'm your nurse educator, RN Boteng. Today we will be discussing oxygen devices, why we use them, when to use them, when to upgrade them, and what signs tell us a patient needs more support. By the end of this video, you'll understand the different oxygen devices, why they are given, and when to choose one over another. We'll also cover when to escalate to a higher level of oxygen support and what warning signs mean your patient may be getting worse. Let's start simple with the nasal cannula. It's the most common device providing low-flow oxygen, typically between 1 to 6 liters per minute. It's ideal for patients with minor respiratory distress who can still breathe primarily through their nose and need just a bit of extra support. Next is the simple face mask. This delivers a higher concentration of oxygen, usually between 6 to 12 liters per minute. Always ensure the flow is at least 6 liters to prevent the patient from rebreathing their own exhaled carbon dioxide. Then we have the Venturi Mask. This is the gold standard when we need to deliver a very specific, precise concentration of oxygen. It's especially useful for COPD patients where giving too much oxygen can actually be a clinical concern. Precision is key here. The Non-Rebreather Mask is for our high acuity situations. It can deliver nearly 100% oxygen at 10 to 15 liters per minute. Pro tip, always make sure that reservoir bag stays inflated. If it deflates, your patient isn't getting the volume they need. Finally, the high-flow nasal cannula. This provides heated and humidified oxygen at very high flow rates, up to 60 liters per minute. It provides a bit of PEEP to keep those alveoli open and is much more comfortable for patients who need aggressive support. Now, how do we know when a device isn't enough? You have to be a clinical detective and watch for these signs. Watch for shortness of breath, increased work of breathing, or tachypnea. That's a respiratory rate that's climbing too high. Physical indicators like nasal flaring and retractions mean the body is working overtime just to get air in. Low oxygen saturation and cyanosis, that bluish tint to the lips or nails, are late and very serious warning signs. Don't forget mental status. If your patient becomes restless, confused, or can't speak in full sentences, their brain isn't getting enough O2. When you see these signs, it's time for action. Here's your nursing toolkit for oxygen therapy. First, position your patient. Sitting them upright allows for maximum lung expansion. It's a simple move that makes a huge difference. Next, assess. Listen to lung sounds and monitor that SpO2 continuously. You need to know if your interventions are working. Encourage deep breathing and coughing if appropriate. Sometimes just clearing those airways can improve their numbers. But what if they don't improve? If SpO2 stays low despite your current device, it's time to upgrade. Now let's talk about the danger zone. This is when your patient is heading toward respiratory failure. If you see fatigue from breathing, worsening lung sounds, or mental status changes, notify the provider or call a rapid response immediately. Let's see this in action with Mr. Jones, who was admitted this morning with shortness of breath. Mr. Jones starts on a nasal cannula at 2 liters. He's stable, but we're watching him closely. 2 hours later, his respiratory rate jumps to 28 and his SpO2 drops to 88%. The nasal cannula isn't enough anymore. RN Boateng switches him to a simple mask at 8 liters. His SpO2 improves to 94%, but he's still working hard to breathe. Seeing his continued work of breathing, RN Boateng knows she needs to upgrade him again and notifies the team. He is transitioned to high-flow oxygen. Now his breathing is rhythmic and his SpO2 is a solid 97%. Success. Patient and family teaching is just as important as the clinical skills. Here's what you need to share. Explain why the oxygen is being used and remind them that more oxygen doesn't always mean better. It must be clinically indicated. Safety is critical. Teach them to avoid fire risks and open flames around oxygen tanks and ports. It's a major hazard. All right, Nurse Scrub Club, it's quiz time. Let's see what you've learned today. Question 1. Which device provides the most precise concentration of oxygen? Is it the nasal cannula, simple mask, Venturi, or non-rebreather? The answer is C, the Venturi Mask. Its specialized valves allow for exact oxygen delivery, making it perfect for COPD patients. Question 2. If a patient's non-rebreather bag is deflating during inhalation, what is your immediate priority? A, B, or C? The answer is B. You must increase the flow rate to at least 10 to 15 liters to ensure that reservoir bag stays full for the patient. Last one. Question 3. Which of these is considered a late and very serious sign of respiratory distress? Tachypnea, nasal flaring, or cyanosis? The answer is C, cyanosis. While tachypnea and flaring are early signs, cyanosis means the body is severely lacking oxygen. Join us on our next topic, heart failure, left side versus right side. Until next time, don't forget to like and subscribe to the Nurse Scrub Club. Thanks for watching and keep up the great work in your clinicals. Bye for now.